Hi, bitch besties. It's your main bitch, Melly. Thank you so much for tuning in and welcome to another episode of the Judgy Bitch Pod.
Hi, bitch besties. Welcome back to another episode. Today is Friday the 13th, but this is going to be our lucky day, and I tell you why. Remember when I had Emily from the Perimenopause Hub on, and she gave us so much great information about perimenopause and what's going on in that stage of life? Well, today I can level up. We can dive even deeper into all these topics surrounding perimenopause and hormones, etc. Everything that we need to know to be really empowered with knowledge. Today I have on Keonté from Discreet Health. Welcome, Keonté.
Hi. How you doing?
Good. How are you?
I'm good. Thank you for asking.
I'm so excited to have you on. I can't wait to dive even deeper and to empower the bitch besties with even more knowledge. And just as an icebreaker, why don't you tell the bitch besties how you and I met?
Yes. So we met over Instagram. I had made a post and then Melly reached out and asked me if I would be willing to participate in her podcast. So of course I jumped at the opportunity. Any opportunity I can get to just shed more light on the topic is golden. So here I am.
I love that so much. And thank you so much for coming on. You know, it's not very common that a stranger reaches out to you and invites you on the podcast, but I love that you jumped on this opportunity and I really appreciate having you here. But why don't you give us a little bit background information about you?
Yes. So I am Keonté Fisher. I am a board certified family nurse practitioner and the founder of Discreet Health. So Discreet Health is a telehealth practice that's focused on women going through perimenopause and menopause. And what led me here was both professional experience and personal. I've spent many years in the healthcare setting taking care of complex patients, especially older women. And they're dealing with the after effects of not being treated through menopause. And so that's one thing that, shifted my focus. And the other part was really going through my own season of not feeling like myself and struggling and not getting answers. Despite me being a healthcare professional, I still wasn't getting clear answers. So that experience really opened my eyes to how many women are just struggling in silence and being told everything is normal when they know that something's off.
Yeah, absolutely. And that's why I appreciate you coming on. I feel like these kind of topics are still not talked about enough. Do you have an idea why that is? Why are we not talking more about it?
Well, I think that historically, it just hasn't been talked about. I think that this whole process has been normalized, minimized. Previous generations before us, they toughed it out. And so that kind of spills down to us. We just think we have to tough it out as well. And then when a woman is saying, I don't feel well, I'm anxious, I'm exhausted, I'm gaining weight, I can't concentrate, and we go to a provider, I think each issue is treated as separate issues instead of someone taking a step back and looking at the whole person and asking, could this be a part of the hormonal transition?
Yeah. Oh my God. You mentioned so many topics right now. We're going to dive into all of them today. That's why I'm so excited to have you here. But let's maybe start again, just for maybe new listeners we might have on. What is perimenopause and when does it start?
Yes. So perimenopause is the transition leading up to menopause. So the definition of menopause is when a woman has been a full 12 months without a period, and not because of a surgery or procedure, a natural, 12 months with no period. So
Right.
in the perimenopause phase, it's that time leading up to that. And it can last for several years, around 4 to 10 years. For most women, it starts in your 40s, early to mid 40s. But for others, it can start as early as your mid 30s.
Mm, crazy. Why do we always have to go through this? Do men go through something like this too?
Oh, I wish. No, we carry it all, unfortunately.
Yeah. So that's what I heard too. That's what Emily shared with us too, that some women start very early in their mid 30s, but typically it's in their early mid 40s, which is the age I'm in. And that's why I find it so interesting to talk about it, because I experience a lot of these kind of things. But if anybody asks me, I'm 25, just saying that.
I hear that.
But can you, thank you. But can you explain to us what is going on with your hormones during that transition time?
Yeah. So, well, I'll start like with the basics. So, when we talk about hormones, we are talking about these chemical messengers that our bodies make. And so, for example, when some hormones are released into the bloodstream, they make your body know it's time to go to sleep. When some hormones are released, it says, oh, it's time to wake up. So, there are different types of hormones that regulate different things. During perimenopause, the main ones that we typically talk about are the estrogen and the progesterone. Those are the main ones, and some testosterone. Um,
Mhm.
During that phase, your estrogen and progesterone become less predictable. So that's the core of it. They're everywhere. They typically this is like this sweet symphony of hormones, like a dance. You know, they go up, they go down, they dance very well together. But during this phase, they're crazy. They're up, down, around everywhere. And so that's what causes a lot of the issues.
That makes total sense. Thank you so much for explaining it. What are some early symptoms that women notice?
Yeah, so probably one of the most reliable symptoms are period changes. That's
Mhm.
probably one of the earlier ones. Your period may be heavier or lighter. It may be longer or shorter. But other really common early ones are changes in your mood, sleep, libido, ability to focus. And then sometimes it's not one big issue, it's just a little bit of a lot of them. And so, yeah, it's more than a woman just saying is I'm something is off. You know, there literally is something off.
Yeah. And you mentioned sleep. Sleep is probably one of my biggest symptoms that I'm experiencing right now. And I wish I could just sleep 8 hours a night like a princess that I am. But unfortunately, I just keep waking up between 2 and 3 a.m. and it's like clockwork. And I have to wake up for my job super early. I wake up at 4 a.m. to be at work at 6. So waking up at 2 or 3 a.m. is really, really painful to me because I'm like, no, I only have 1 hour left to sleep. Why am I not sleeping? And I saw a great post that you put on your Instagram, and you said sleep shouldn't feel this hard. Can you elaborate on that a little bit?
Yes. This is something I hear a lot from a lot of women. And I experience it myself. Yeah, it's just hard to get good sleep during this age or during this period. And the reason is, you know, the hormonal shifts that we have, they can affect temperature regulation. And so when our body temperatures rise, that can wake us up. We have a different sleep quality and we sleep lighter. So,
Mhm.
you know, it's easier to wake up. And then of course the hormonal changes play a role into that too. So some women, even if they are in bed for like a full 7 to 8 hours and they are sleeping, they still may not feel well rested because of these changes.
Oh man, yeah, I can definitely testify to that as well. And I think stress also comes a lot, or stress brings a lot of cortisol in your body as well, right? Can you explain how is it correctly? What does cortisol have to do with all of that?
Yes. So cortisol is our stress hormone. Cortisol
Mhm.
is a hormone that's made by our adrenal glands. They sit on the tops of our kidneys. So cortisol is helpful because it's like an alarm that helps you handle emergencies, helps you wake up and focus. But during perimenopause, a lot of times our cortisol shoots up. When we're sleeping, cortisol naturally begins to rise, like as a part of the circadian rhythm. And so it's supposed to like gently ramp up your body and get prepared to wake up. But in perimenopause, we lack progesterone and we have estrogen that's going up and down. And so as a result
Mhm.
of that, our cortisol jumps up and then that curve gets exaggerated. So instead of us having a gentle wake, it's just like, oh, I'm up and I can't get back to sleep. So yeah, what we're literally experiencing is a jolt of stress hormones in the middle of the night when we should be sleeping.
That makes total sense. You're explaining it wonderfully. Thank you so much for doing that. That makes total sense and is so understandable. Do you also have a tip or a solution what women can do to support better sleep during that phase?
Yes. So I have a tip. It's not always easy, but the cortisol being the stress hormone, something that helps is really trying to get good relaxation techniques down before bed. So that may look like jotting down everything that crosses your brain before you go to sleep. Because a lot of
Mm,
times our minds are going a million miles per minute. We've got so many things that we forgot to do today, so many things we have to do tomorrow. So just sort of getting those all out on paper can help, reduce
yeah.
some of that anxiety. Another thing is just relaxation, whether that be meditation, prayer, a relaxation ritual. You get maybe a glass of chamomile tea at night before bed, or you just have a routine where you take a shower and, essential oils, that type of thing. So just trying to get into a habit of having some way to wind down helps to reduce that cortisol spike a little bit.
Yeah, that makes sense. That totally makes sense. And I struggle with anxiety too. So I try to do these kind of rituals. And I notice on days where my overall anxiety is lower, of course, I also sleep better at night. But speaking of your mind and the thoughts and all this, another symptoms I notice a lot is the brain fog and just the cognitive changes. Like sometimes I can't even get a full sentence out. And I don't know if it's me being bilingual or, if it has to do with perimenopause, but the brain fog is definitely a real struggle. Like you go to the kitchen and by the time you get there, you forgot why you even went there. Is that a symptom?
Yes, yes. And don't feel bad because you are not alone. I go through the same thing. Sometimes I can't even speak in a full sentence because I forget what I was talking about. But yes, brain fog is definitely a real thing. It happens because, again, we have that issue with the hormone fluctuation, but it affects our ability to learn new things. It affects our memory, our ability to pay attention for long periods of time. And also, some vitamin deficiencies can worsen brain fog too. So,
Hmm, interesting. Yeah. And what role plays estrogen in that area?
yeah, so we have estrogen receptors all over our bodies, like from head to toe. And so when
Hmm.
estrogen is there 1 minute and then it's missing the next, it affects our brain function. Um,
Okay.
and then another reason is that estrogen is protective against neuroinflammation. So when we just,
Hmm.
inflammation or swelling in our brains, estrogen protects against that. And when we do get the inflammation, that can cause us to have, those cognitive changes in migraines, things like that.
Yeah. Would you say that those changes are temporarily while we're going through this? Do they end with menopause or after? Does menopause have an end? I don't even know.
Yes, yes. So for many women, it does improve once they have gotten past menopause.
Okay.
But also it will improve if we, address symptoms like poor sleep and stress. That'll help with the brain fog too.
Okay. And you know what I see popping up on my Instagram a lot, especially because I talk about these topics and, my phone always listens and then it will give me the ads for hormonal testing. And they make you believe that your normal doctor can test the hormones correctly. And that's why you should spend extra money to get a deeper testing. Do you believe in that? Is that a real thing?
So I think it depends. I have mixed feelings about it. Perimenopause, your symptoms won't line up with like lab value. At least not, um, at least not neatly, right? Your
Mhm.
hormones fluctuate a lot. So when you get your blood drawn, it may be normal for that day, but that
Mhm.
doesn't mean that it was normal the day before or that it will be the day after. Um, Another thing is that normal lab values, the way they come up with it, is that they take a group of people, a group of healthy adults, and they check the blood work, and whatever 95% of that group's range is, that's what they call normal. Um,
Ah,
Labs were designed to identify like obvious disease, right? So it doesn't necessarily always define your optimal health. It doesn't tell us what you feel best at or what levels you feel or function best
Mhm.
at. So that's the issue with labs. But I do
Okay.
feel that they have their place, especially when it comes to us testing for nutritional deficiencies, because
Yeah.
sometimes, even though we're trying to eat well, for whatever reason, our bodies just aren't getting enough vitamins and nutrients from our foods, which can
Mhm.
also make these symptoms, much worse.
I see. That makes total sense. So what would you recommend? Going to your doctor and have what tested exactly?
Yeah, so when you go to your doctor, you can always ask for their typical lab panel, right? So
Mhm.
there's a CBC that checks your blood counts that lets us know whether or not you're anemic. I like
Mhm.
to recommend that we also get an iron panel just to make sure, especially if your periods have gotten heavier, because if you're losing that extra blood, that's going to make you feel weaker or more fatigued. So that's one thing. The
Okay.
other thing that we like to look out for is your comprehensive metabolic panel. So that lets us know what your electrolytes are doing, your sodium, your potassium, your kidneys. That gives us insight into that. That's a pretty basic panel. We always
Mhm.
check on thyroid because if your
Yeah.
thyroid is off, that can also cause some symptoms, weight gain, fatigue, that sort of thing. The other thing that we check is your glucose. So in my clinic, I like to do a hemoglobin A1C that lets us know what your blood sugars have been ranging over the past 3 months. But I also
Mhm.
like to check a fasting insulin. That one is harder to get insurance to pay for sometimes. But what
Mhm.
happened is when we hear people talk about metabolic syndrome, that fasting insulin level will let us know whether or not, that's where you are. That will often give us a clue before that hemoglobin A1C will. Um,
Interesting.
Let me think what else. As far as vitamins, we want to check vitamin D level, vitamin
Mhm.
B12, folate. And then when it comes to hormones, what we typically check is the FSH, your estrogen, progesterone, testosterone, and DHEA. So those are the main ones. You
Mhm.
should be able to get most of them from your normal doctor. I think that sometimes what our normal doctors may look at or
Mhm.
the ranges that they use may look fine. But for example, in my clinic, I use a different set of ranges because there have been studies that show that when women have their ranges optimized, so not normal, but within certain levels, they feel better.
Interesting. Okay. That was very good insight. Thank you so much for sharing. Do you believe that your nutrition level change in perimenopause? Like, do you need more vitamins and more nutrition because your hormones are fluctuating and your body maybe needs more energy to go through this? Is there a correlation?
Well, this is partly my opinion. I do. So there are many things. I don't want to go off on a tangent, but there's so many things that affect it, right? A lot of times we hear about gut health. And what happens
Mhm.
is a lot of us don't have good gut health, or we don't have the best bacteria in our gut. So when we eat our foods, we may not be able to absorb all the nutrients from it. Another theory
Mhm.
is that because of how we get our food, it's usually mass produced.
Yeah.
Over farming, is there enough nutrients in the soil? Is our food as good a quality as it used to be? That sort of thing. That's another theory. And
Yeah.
so I do feel that I don't want to say that everyone needs it, but when you're having symptoms, I definitely feel that it's worth looking into. I don't recommend taking a supplement just for the fun of it, but if you're not feeling well, I do think it's worth you looking into to try
Mhm.
to correct or bring back what you're missing.
That's really great advice. Thank you. And speaking of nutritions on all this, obviously metabolism change is also a big topic we can talk about. Why is it that a lot of women feel that during perimenopause, their metabolism changes so rapidly?
Yes, because it does. Because it does. So what's happening? Our bodies aren't making as much estrogen. When that happens, it causes us to become insulin resistant. So the insulin that our bodies produce doesn't work as well. So that cause it makes it harder for sugar to when you eat your food. A lot of times certain foods are broken down into sugar. That sugar has a harder time getting into your cells so your body can use it as energy. And so as a result, your body stores it as fat.
Okay.
Yeah, so that's one reason. So the insulin resistance is one thing. A second issue with metabolism is that when we stop making it as much estrogen, again, our bodies push out more cortisol. And that cortisol being a stress hormone, when it stays high for a long period of time, it causes us to gain weight. It causes us to lose muscle and it slows down our metabolism. And then the third reason is that estrogen protects our muscle. So when that starts to drop, we lose our muscle mass. And then when we don't have as much muscle on our bodies, we have a lower resting metabolic rate. And so our bodies don't burn as many calories as they used to while resting. So that's why even though we're eating and exercising the same, our bodies just aren't burning those calories like they used to.
That makes sense. And I feel specifically the pouch area,
Oh, yeah.
specifically the belly is something that, I eat normally. I try to be healthy as I can. I exercise, and that belly is just here to stay. Is that also a symptom?
Oh my goodness, yes. That is one of the most frustrating things. Especially when you're doing everything right, working out, eating the right foods, but that is just something that happens. For some reason when our estrogen drops, our body shifts where it likes to store fat. So where it used to store fat, down below your hips, your thighs, we all like it there.
Yeah.
It starts to migrate right on up. And that's, it's because of the rewiring due to the hormone changes.
Yeah. And I have to ask you another personal question.
Yeah.
I also noticed my boobs have gotten so much bigger. Is that my genes kicking in because my mom is very blessed in that area? Or is that also perimenopause?
So I guess it depends. You know what? I don't know. Truthfully, I don't know. I wonder if it could have something to do with like the fat being redistributed. I don't know.
Yeah.
That's a good question.
Okay.
Yeah.
Interesting. Well, I'm blessed, I guess.
Yeah. Yeah.
Some people pay a lot of money for it.
That is true. That is true.
But there's no milkshake over here, so
Oh,
there's no boys in my yard.
I know that's right.
What would you say? What habits would actually help your metabolism during perimenopause?
Yes. So probably one of the best habits is weight training, training. And I think sometimes as women, we don't lift heavy because, we don't want to be like bulky or anything like that. We
Yeah.
actually need to in order to like rebuild that muscle and protect what we have. So that's one thing. Strength training, lifting heavy weights. That's one thing. The other thing is eating plenty of protein because, of course, protein also helps us to build muscle. So
Yeah.
that's the other thing. And then blood sugar regulation. So with that, the things that make our blood sugars rise and fall quickly are refined carbs, right? So like
Mm.
white bread, pasta, white rice, sugars, any processed foods. Those are things that make our sugar shoot up. And so that if we try to keep that pretty steady by avoiding that, that's helpful. And then, of course, healthy, good sleep habits. When we get better sleep and when we manage our stress better, we'll have less cortisol. So that helps to keep our bodies from storing so much fat.
That makes total sense. And I just want to tell the bitch besties because I work with a personal trainer and I also work with a nutritionist. When you mention lifting heavy weights, you don't mean 150 pounds. We don't need to be able to lift 150 pounds. It depends on which exercise you're doing. If you're doing an arm exercise, if you can lift a 10-pound weight, that's great. You should do this regularly and also try to level up. So when you feel like, okay, this doesn't hurt as much as last week anymore, well, then try to grab the 12-pound weight and see if you can get through the exercises. And the last 2 reps you do should always be a little difficult and struggle. And you also mentioned all the good stuff, meaning carbs. I learned from my nutritionist that we don't have to cut them out completely because anything you forbid yourself, you will crave even more and then you will binge eat. But as you say, just be mindful of it and try to avoid it where you can. But that doesn't mean you have to cut it out completely. You are still allowed to eat bread. It's just a balanced meal, I think, is the key here. That's also what you said, to really watch out for these nutritional factors you want to have in there and not just eat pasta and bread all day long. That wouldn't help you.
Yes, I totally agree. I totally agree.
That's pretty much what you said. I just wanted to reiterate it and make sure that we're sending the right message to the bitch besties.
That's right.
And let's talk about mood and anxiety and depression a little bit. How connected are hormones to these areas during perimenopause?
Yeah, so they are very connected. Very connected. For some women, this time in their lives is like the first time that they ever notice being irritable or anxious or having a low mood. For
Mhm.
other women, we might have a pre existing tendency already. And so when we get to this period in our lives, it gets so much worse. And the reason being is because estrogen, it directly influences our brain chemistry. It modulates neurotransmitters. So, like our serotonin, dopamine, norepinephrine, those feel good chemicals,
Yeah.
those are the ones that, kind of control our mood, our motivation, focus. When estrogen drops or fluctuates, our brain chemistry is literally destabilized. So it's not us overreacting or being anxious because we're stressed. It's literal neurochemistry.
That makes total sense. And you know what? I have experienced that I can share here too. And the bitch bestie might know that if they've listened to previous episodes. I had surgery in October last year for getting a huge fibroid removed from my uterus. And of course, that caused my hormones to fluctuate for a short period of time, understandably. And all of a sudden, I experienced for a week or two like a really bad depression. So I really felt my hormones at work during that time. And it's crazy. Generally, going through perimenopause outside of that short experience I had there, I noticed that too, that my anxiety is getting more and, depression, not so much. I'm very blessed in that area, but definitely my anxiety. What would you say can help with reducing that a little bit or work towards reducing it?
Yeah, so some of the things that we kind of talked about, so really focusing and honing in on those relaxation techniques. Sometimes just getting everything out on paper helps.
Yeah.
Have so much going on in our brains. Having a tribe to turn to or support to turn to just to vent is sometimes
Mm-hmm.
helpful. And sometimes setting a goal to say no for the day,
Yeah.
because we juggle so many things that we can sometimes get inundated with everything that we need to take care of. So being able to say no, I won't be able to take care of that right now, or even asking a family member, spouse or loved one to take something off your plate, sometimes that can be helpful.
That's a really great point. I'm glad you're bringing that up. That's really helpful. Another thing I notice is that I am so emotional these days. I watch TV and the slightest thing tips me off and I tear up and I start crying. I had a friend yesterday send me a voice message and go like, "Oh, Melly, we haven't spoken in a while. We should talk on the phone. I miss you." And I was in tears. Why is it that people in perimenopause tend to get so emotional all of a sudden?
It's rough. It goes all reflects back to those hormones, those receptors in our brain. When they're up and down, we feel it. We feel it.
Yeah.
And so that's the main reason, the fluctuation in the hormones.
Interesting. Okay. Let's talk a little bit about treatment options. There's a lot of women who are scared of taking hormones, but one of the biggest therapy option, I guess, for like more severe cases is hormone replacement therapy. Can you talk a little bit about all those treatment options and what does it actually mean and what do they do?
Yes, yes. Um, so I think a lot of the fear that women have today about hormone therapy sort of all began with the study that they did back in 2002. Well, it was published in 2002, the Women's Health Initiative. So when the results were released, there was a huge concern that hormone therapy caused breast cancer and heart disease. So just
Mm.
overnight, millions of women had to throw away their prescriptions. Doctors stopped writing it. And the results of that have like really persisted, over 2 decades. But there
Yeah.
were some issues with that study. One of the issues was that the average age of those women was 63. So
Mhm.
63 is past menopause. Um,
Mhm.
and the study didn't really take into account, it didn't have women who were not who were younger, essentially. It didn't look at
Okay.
perimenopausal women. The other
Mhm.
issue is that study used medication that it was an oral pill, but it consisted of two things. A part of it was synthetic progestin. It wasn't bioidentical progesterone like what we use today. And then the other
Mhm.
half of that medication was equine estrogen that came from pregnant horses' urine. So that was the medicine that was used in that study. When it came out, it said that the risk for breast cancer was a 24% increase, which of course sounded really, really alarming. But to put that into context, if a woman is obese, or if a woman has a large glass of wine or a shot of liquor every night, that automatically increases their risk of breast cancer by 11 to 50%. So they
Oh,
were
wow.
saying that this hormone therapy increased it by 24%. Another point is when you look at actual numbers and not percentages, the risk of the breast cancer was actually 4 out of 1,000 women over a 5-year period.
Mm.
Yes, so 4 out of 1,000 over the course of 5 years had that
Okay.
increased risk. Um, Interestingly, in that study, the women who only took estrogen, they had a different response. So they actually showed a reduction in breast cancer risk, um, and also a reduction in, I think it was the cardiovascular issues as well.
Mhm.
Um, So that was the study then. But what we see now, what we've learned from that is that when we start the hormone therapy within 10 years of menopause, it has a very different risk benefit profile. So when women are started during this window, they see positive cardiovascular effects. There's cognitive protection, so possibly reducing the risk of Alzheimer's. Have
Mhm.
better bone density, so
Mhm.
not as vulnerable to fractures. And then just a significant improvement in quality of life. So we saw that change, and we also saw that the type of hormones that we use matter. So we really like to use, of course, bioidentical hormones. So
Okay.
instead of what was used in that study, we use micronized progesterone. It has a much better safety profile than what they used in that study. And we also see that when we do transdermal, it bypasses a lot. And you don't have as much of risk of like a clot or a stroke when we do things that way.
Interesting.
Yeah.
Thank you. Thank you so much for explaining that. And I hope that takes a lot of fear of the bitch besties listening out there. Because for some reason, everybody is always even afraid to take birth control sometimes because it's always such a stigma of saying, no, I don't want to put hormones in my body.
Yeah. So interestingly, when we do hormone replacement therapy, the doses are not as high as what birth control is.
Interesting.
So that's something to keep in mind too for women who did feel comfortable with taking birth control. The doses that we use for hormone replacement are not as high.
Interesting. And who would you say is a good candidate for hormone replacement therapy?
Yeah, so most healthy women in perimenopause or early postmenopause who have like really bothersome symptoms, they're probably candidates for hormone therapy. We have to use caution in some things like high blood pressure, high cholesterol, and migraines. Those are situations that we use caution. It's not an automatic no, but it's definitely
Right.
something that you have to discuss so you can weigh those risks and benefits with your provider.
That makes total sense. And is there a non-hormonal replacement or option that you could do also?
Yep, yep. So not every woman wants hormones, which is totally fine. There are FDA approved non-hormonal medicines that treat hot flashes, treat
Mhm.
mood, also may treat libido. But then there's lifestyle approaches, some natural remedies, sleep support strategies, things like that, depending on the symptoms that she's having.
Since you just mentioned it, we talked about this in the episode with Emily, but libido and hot flashes is very much a symptom as well.
Yes, yes, they are. They are. The hot flashes goes back to that dip in estrogen. It helps to regulate estrogen regulates our body temperature. And so when it's up and down, it can cause our temperature to be up and down too. So that causes the hot flashes. And then with the libido, there's some not controversy, but there haven't been really good studies in women with regards to the loss of testosterone and how that affects libido. Clinically, what I see is that for some women who come in and we test and they do have low testosterone and we replace it, libido is often improved. However,
Mm.
when we talk about studies, there's a lack of information there. Also, with libido, the part of our brains that controls it when we have so many things going on, work, family, just everything going on, stress, not getting enough sleep,
Yeah.
libido is all clogged up there in that part of our brain. So it's kind of hard to want to be intimate when you have so many other things going on. There's no one fix because there are a lot of
Yeah.
things that make up how well a woman's libido is.
Mhm.
So yeah, it takes in a lot of things are taken into account. Another thing, are you uncomfortable? As we get in this period, a lot of us may not have that vaginal lubrication or moisture. So if sex is uncomfortable, of course, that's not going to be something that you want to do. So yeah, there are a lot of different reasons.
Yeah. And I also feel we've gotten better with this, but I also feel that a lot of women feel that they're being dismissed by their doctors when they describe their symptoms and they really need to advocate for themselves. What would you tell those women? What should they say to a doctor when they suspect hormonal changes?
Yes. So I really feel passionate about knowing what you're going to talk about before you go into the doctor's office. So one of the
Mhm.
most important things I recommend is tracking your symptoms before you go. And so I usually tell
Mhm.
my patients, make sure spend time tracking 2 to 4 weeks at least, day to day, writing down how you felt that day. How'd you sleep? Are you having hot flashes, brain fog, joint pain? Write it down. And then also make sure that you have your cycle included in that. So that way, that'll
Mhm.
give your doctor more information so that he or she can kind of put it together. And then also go in and be specific with your symptoms, not just saying, I don't really feel well. Name your symptoms and then be able to point them to your timeline. So
Mhm.
that's really important too.
Interesting. And what other advice do you have for women going through perimenopause?
So one thing that I would say is to don't isolate yourself. Make sure you find your people that might be a knowledgeable provider, online community, a friend who understands you, just someone because we don't want to isolate. That can make everything so much harder. And sometimes just being able to have a conversation about your journey and your experiences, that can be medicine in itself. Another thing I would say is trust yourself. What you are feeling is real. It's not in your head. It's not a weakness. It's biology. It's something that happens. So trust yourself. If you feel dismissed, then you definitely want to keep searching, until you can find a provider who listens and takes you seriously.
Yeah, that's really great advice. Thank you. And can you talk to the bitch besties a little bit about your telemedicine practice? Who do you work with? How does it all work? Where can they find you? Give us the whole picture, please.
Yes. So Discreet Health is a telemedicine practice. I focus on women in perimenopause and menopause. So I work
Mhm.
with women who are dealing with all the symptoms we spoke about, sleep changes, mood changes, libido, brain fog, weight gain. But each woman has an individualized approach. It's not a one size fits all clinic. For me, it's very important that I uncover any underlying issues because I believe that if we have a strong foundation, when we go through this period, the symptoms won't be as bad. So I always like to check that. I do look at those advanced labs and just try to look at things from a functional medicine perspective. The functional medicine perspective always digs for root causes and it tries to get the labs or the levels in your body at the best range that helps you function at its best. So I
Mhm.
try to do that. As far as finding me, my website is discreethealth.org. I'm also
And Discreet is with two E's. We should
two
also
E's.
mention that.
Yes,
Yeah.
discreet with two E's. And then you can also find me on Instagram and Facebook. And right now I take care of women in Virginia, Maryland, DC, and Delaware.
Okay. Do you also offer telemedicine for people outside of those areas?
No, unfortunately, I can't. As a nurse practitioner, we have to be licensed in the state where the patient is at that time. So right now, those are the only
Interesting.
states that I'm licensed in.
That makes total sense. Well, you're covering a huge area, so that's also important to know. Please shout out one more time your Instagram. And the reason why I'm asking you to do it is because you have really great posts on there. I really like your Instagram page. There's so much information there. And as I said, I found the one about the sleep that was amazing. So please shout it out so the bitch besties can follow you there.
Yes, so it's discreet health underscore VA. That's my Instagram handle.
I love it. Thank you so much. Keonté, you shared so much information. I love it. You gave great insight. But before I let you go, do you still have 2 minutes to play some fun games with me?
Yes.
Okay, perfect. I always like to end the episodes on fun games.
Okay.
The first game is called Myth or Fact. Actually, let me put my glasses on so I can read better. Eyesight is also something I struggle with, but I think that this has to do with aging. It doesn't necessarily mean perimenopause symptom, does it?
I agree. Nope. It has something to do with aging. I think in our 40s, that's when we start to need the reading glasses. I have the same issue. My doctor recommended the progressives and I tried them and I was like, oh, I can't do this. So I still go from take the glasses off and on. So it's okay. I understand.
That's what I do too. And I will tell you, these are cheap glasses I got off of Amazon, a pack of 10 or something. And in every corner of my apartment, there's a pair of glasses.
Yeah. No, I understand. Trust me.
All right. So the first game is called Myth or Fact. So I'm going to just give you a statement and you tell me, is it a myth or is it an actual fact? So the first one is brain fog means something is wrong with your brain.
Myth.
Weight gain in midlife is unavoidable.
Um, I would say myth, but you have to do something in order to avoid it.
Right.
Yeah.
And also genes kind of play a role probably too with your weight gain, right?
Yeah, absolutely. Absolutely.
Yeah. Okay. Hormone therapy is dangerous.
Myth. And this is probably something that I really care about. Any medication will have risks, right? We prescribe
Yeah.
insulin to patients all the time. Insulin can kill people. It had, people wind up in the hospital from blood sugars dropping too low all the time. So yes, there are some risks with hormone therapy, but they are no higher than any other medications that we use on a daily basis.
Yeah. And you mentioned earlier, you explained it very well, and I appreciate that. The last one for this game is poor sleep is just part of aging.
Oh, that's a myth. That's definitely a myth.
Absolutely.
Yeah. Yeah. It's definitely related. The hormonal changes.
Yeah, absolutely. The last game I have for you is called Rapid Fire. So I'm going to start a sentence or give you a statement, and whatever pops into your head, you finish that sentence or you explain that statement. Okay?
All right.
So the first one is one thing every woman in her 40s should know.
You are not crazy.
Love it. Most underrated hormone health habit.
Ooh, most underrated hormone health habit. No, I would probably say ensuring that you're getting enough sleep.
Yes. We princesses, we need our sleep. I agree. Or queens. Princess
Right.
or queens, whatever you identify as. We're not discriminating on this podcast. We're very inclusive. um, biggest myth about perimenopause.
Probably that biggest myth about perimenopause. That is something you have to tough through. Yeah.
Yeah.
That is something that you
Yeah.
just have to tough out.
And the last one is one symptom women should not ignore.
Anything that affects their daily life. Anything that affects your daily life. So if your mood is affecting your daily life, if your inability to sleep is affecting it, yeah, don't ignore it. Don't ignore it.
I agree. Keonté, thank you so much. Once again, Bitch Besties, please go and follow her on Instagram at Discreet with 2E health_VA and also at discreethealth.com is your website. Did I say that right?
Yep, discreethealth.org.
Org. I'm sorry.
Right.
I knew something was wrong. Discreet with 2E health.org and Discreet with 2E health_VA is your Instagram. Please go and follow Keonté. Keonté, I want to thank you so much for coming on. It was great information you shared with us. And thank you so much.
Yes, thank you so much for having me. I really enjoyed it. This was fun.
Thank you so much. Bitch Besties, I see you next week. Happy Friday the 13th. Bye.
Thanks, Bitch Besties, for listening. Make sure to follow us at the Judgy Bitch Pod. And hey, spread the word. Tell your friends, your ex, your dog walker. We'd love their support. Want to be part of the show? DM us your feedback, hot takes, or unapologetic opinions. We just might read them on air. And don't forget to follow, rate, and review the pod. See you next week. Cheers, bitches.